Hi everyone. Good evening. Bonsoir tout le monde.
Good evening. Welcome to our question and answer session with me, Susan Holt, the Premier of New Brunswick.
The Premier of New Brunswick, and we're going to do another live Q&A session tonight. But first off, I wanted to start with just a quick thank you to Crystal and Stalin Venator, who sent me this amazing Jokes Are For Everyone book. And I really appreciated it. There's some good chuckles in here. I thought I'd share one joke with all of you. I picked a Halloween one. So Stalin, if you're watching, thank you very much for this. Sometimes when things get tough in the Premier's office, this brightens my day. So this joke says, who won the skeleton beauty contest? Nobody. It's a good one. Anyway, merci beaucoup, Crystal and Stalin. Really appreciate that. It's great to have such creative people in our province. Okay, je vais vous expliquer.
I'll be explaining how we'll be managing this question and answer session tonight because it's a little bit different than last time. We're testing different approaches to see what works best, and we'd like to have your comments on the format.
If you're looking for simultaneous translation, the links are available on my social media. So there's an English feed, a French feed, there might be an original feed on YouTube at least. Okay, yes, I'm getting nods. Alors, moi, je vais switcher.
So I'll be switching from
English and French a little bit, and then I'll answer the questions in the language that they were received. In some cases, we get the same questions in both languages. Alors moi, je vais être en français, en anglais.
So I'll be speaking in French and in English at different moments. There's a translation team here with you so that you can better understand what is happening.
Opened up the online site to receive your questions between October 9th and October 22nd. So we left it open for 2 weeks. And in that time, we received 273 questions in English and 18 questions in French. Alors,
So then we closed the opportunity to submit questions, and we created a vote to see who would vote for which questions. Every person had 4 votes that they could vote for any question they wanted to vote for. Out of the 300 questions that we received.
Open from October 23rd right through till October 30th for 1 week. So we received 147 votes on the French questions and 1,943 votes on the English questions. And so I'm going to go through and answer the top voted questions. I think the most votes that any one question got was a little over 200. So really popular question, then I'll work my way down as the time rolls on and get through as many questions as I can for you. Nous avons
we broadcast this session directly on my social networks, on Facebook, Instagram, LinkedIn, YouTube. You can see the links on those different networks for the translation. You can also provide comments about this format compared to the previous format, the last time that we had a similar session online.
To provide in terms of the off-the-top feedback. So let's jump right into the most popular question that was asked this time. This one was asked both in English and in French. So the French question was, Bonjour madame, concernant...
Hi. When it comes to quality of air, what are the actions that the province is implementing when it comes to reducing the use of glyphosates?
Spraying in forests despite proven harms to health and environment, and why are taxpayers footing the $26 million a year to subsidize J.D. Irving's use? It's time for something safer. And a similar question, when will you put an end to glyphosate spraying? So we combined all those 3 questions up. That generated 193 plus 29 plus 25 votes. And so that's the one that we're going to start with today. So Minister Lepage, who is our Minister for the Department of Environment and Local Government, in his mandate letter, there is an item, I guess, that we're looking for him to complete that includes a review of pesticide use in this province. And so that's something that we are looking to get completed in our mandate. But that work is ongoing, and I think there's some studies that we have scheduled that are going to begin next year. So there's going to be opportunities for public engagement on those studies. The minister is working with the minister and are working with other departments on the work to achieve his mandate of reviewing pesticide use. And then the focus really has been on the recommendations that came from the steering committee for the standing committee, the standing committee of the legislature on climate change and the environment. They issued recommendations under the previous government that were unanimously supported by the members of that committee, but actions hadn't been taken on those recommendations yet. So our government is moving on the recommendations that they made to restrict and reduce glyphosate use around the province so that it is bigger buffers, more tightly monitored, that kind of thing. Je vais juste checker.
I'd like to check to see. I'll be repeating what I said in English because this one was asked in both questions. There's a mandate from the Minister Lepage that includes an assessment of the use of pesticides in the province, and this work is underway. The minister is collaborating with other ministers that are involved, and we're focusing on the recommendations that were included in the report from the Committee on the Environment and Climate Change. And other aspects to the mandate, such as completing studies, will start next year and will also involve opportunities for public participation. So we're asking you to be involved, to participate on these consultations, and so that we can implement the recommendations from the committee.
So this one, there was also a French and English question that were similar. So the English question was, what can be done about high electricity bills, property taxes, pardon me. They are pushing seniors out of their homes. La question en français était, bonjour madame.
The question in French was, what are the actions that the province is implementing to mitigate the effects of inflation when it comes to electricity rates? We received 186 votes for the question in French, 27 in English, and 27 for the question in French. This was one of the most popular questions.
Bills and property taxes. I'll try to combine the two a little bit. One of the first things we did when we formed government was take 10% off of NB Power bills. So you'll see starting January 1st of 2025, there's a 10% rebate line that took that 10% off of your power bill. That was the first step that we took. Then we realized that there's significant challenges that NB Power is facing, and so we ordered, well, first the audit and now a comprehensive review of NB Power. That work has been ongoing and is due to come back to us in the form of recommendations in March. The next thing we did, because we had seen numerous years of pretty high increases, 9% plus increases to power rates, we changed the date. We removed the debt ratio target that was in place to take some of the pressure off that was driving rates up. And then we saw instead of a 9% rate increase this year, a 4.75% rate increase request that NB Power has filed, in part because we removed that debt ratio target. And then we're waiting to see that that's going through the EUB hearing process, and we're looking forward to taking action on some of the recommendations that the comprehensive review panel will bring forward. In terms of property taxes, we froze your property tax assessments this year. So the bill that you'll get that comes through this winter will have a frozen assessment level, and then depending on what municipality you live in, whether they have chosen to freeze their rates or move their rates will impact whether your property taxes go up or not. And in the meantime, we're overhauling the property tax system because we think it does need to be more predictable, more competitive, less volatile, so that people aren't seeing dramatic changes year over year. And that work is ongoing right now. In fact, there was a public survey put out that received thousands and thousands of responses. So great to see the engagement of New Brunswickers with your ideas for how we can make our property tax system clearer, more simple, easier to understand, and more competitive for everyone. And within that, we're also receiving suggestions, just to bring it back to the question, about property taxes for seniors. There are other provinces in Canada that have different forms of discounts for people depending on their age, their retirement status. Sometimes it's a freeze to property taxes. Sometimes it's a discount of 5% or 10% on property taxes. So we're looking at ideas like that, suggestions like that are happening around the province, across the country. To see if any of those will fit into the kind of property tax system that we bring forward in 2026.
There are a number of elements, a number of things that we're doing to try and reduce your electricity rates. Electricity bills. The first was that we reduced electricity bills by 10% starting 1st of January, 2 months after we started we formed government, and we also realized that there were other issues, so that we requested a study, a complete audit of NB Power, and we asked for recommendations from a committee as well, and we'll wait to see what those recommendations are before implementing them. We also reduced the debt ratio for NB Power. The pressure to attain a certain target for their debt ratio, this is something that contributed to increases to electricity rates of 9% and over year. So we removed that pressure. This year there wasn't a request for 9% increase, but rather it was 4.75%. I understand that this is still quite high for many people, so we want to implement other changes as well to see that if we can have more stable electricity bills and rates for New Brunswickers. We're also reforming the property tax system. We placed a freeze on property tax assessments. So the next bill that you'll receive will have that freeze on those bills. Depending on the municipality in which you live, there are some that may have a freeze on their portion as well, or there might be an adjustment. We, for our portion, there is a freeze. And because we're doing a reform for the system, the property tax system, we're requesting recommendations so that it be more stable, more competitive, better, easier to understand, and to know how that number was arrived at. We're looking at different ways we can help seniors and looking at other provinces and the help that they offer for seniors for property tax assessments. So that's something we're also considering because of this work that we've undertaken to reform the system, and this will be implemented in 2026, so that next year you'll have a freeze, and then the following year there will be the changes because of the reform.
Question number 3. This one is, so this one's the timing is a little funny. So the question is, when are you getting rid of the carbon adjuster that's adding 8 cents per litre to the price of gas? You keep promising it. Why are you not dropping gas tax like you said? It has doubled. Pourquoi devons-nous payer la taxe?
Why do we have to continue to pay the tax, carbon tax, for companies that are continuing to benefit from it? Other provinces aren't doing that. When will you keep your electoral promise and eliminate it? Donc, il y avait plusieurs personnes.
Today actually, that we will proclaim Bill 4 and remove the cost of carbon from the price of gas, and that's going to be effective December 1st. And so the price of gas should drop by 8.24 cents on December 1st, delivering on that promise and giving you some relief at the pumps, because we have heard consistently from New Brunswickers going back to last summer before we made the commitment and all the way through the past year that the cost of living is high. The cost of groceries, the cost of rent and mortgages, the cost of gas, the cost of living is a real challenge in New Brunswick. And so we delivered on this promise. It's going to come into effect December 1st. And we're really doing everything we can to try to deliver relief to you. Il y a une question aussi pour...
There's a question as well. Why that was promised, why it took a year to do so, because it was in last November, where we put the bills in the legislature for the first time. There were objections from the industry, from the opposition, that didn't want us to do that. And we gave them an opportunity to express themselves. We listened to the interveners. We gave the opportunity to present in committee of the legislature. We considered their points of view, and we asked the board to do a review of the margins. They did that, so we gave all the opportunities. We listened to all, but we believe it's a time that people deserve to have this help, this promise be realized to reduce cost of carbon, to remove the carbon cost or the cost adjustment on the price of gas. So we removed it on December 1st. 8.24 cents going to be removed for you to help you to have an affordable life here in New Brunswick. So I'm glad that we did it finally. I know that some people are concerned for small gas stations in the community. There's a problem with the Commission to show the real costs so that we can ensure that New Brunswickers do not pay too much for gas in our province.
I'm trying to think if I did that one balanced in English and French. It felt more French, but okay. Going on to the fourth question, I believe, now that I've lost track. 1, 2, 3, 4. Why won't you stop the NB Power rate hikes every year? So this question received 85 votes. It was only asked in English. And so I'll do my best to tackle this one now. In the past, there have been times when government has intervened in the process with the EUB, with the NB Power rates, and held rate increases to 0 or held them at a 1% or 2%. That's happened on and off over the past many decades, with different governments of different stripes getting involved to hold or delay or to put off increases to power rates. That might be one of the reasons why power rates in New Brunswick are lower than our neighboring provinces, is because of continued years and years of holding increases pretty low. And with that, we've generated a significant amount of debt and have had challenges managing the finances of NB Power in terms of investment and maintenance. And so we have a real balance to strike here as New Brunswickers struggle with, as I said, the cost of living, with rate increases, with electricity bills that are getting bigger and bigger, with our energy consumption increasing. It's something that's really challenging for people at home. And the situation of the past has been really challenging for NB Power, who's burdened with a debt that doesn't allow them to do some of the things that they need to do. That's why we launched the comprehensive review. We think we need a different path with NB Power because we can't continue this way. We can't continue generating the kind of debt that the utility has. We can't continue with double-digit rate increases. I don't think that the population can bear or can afford that. So we need to find a way to change the structure of the utility, its policies, its programs, something, anything, everything that will allow for us to deliver affordable, reliable, sustainable power to New Brunswickers in a way that they can afford. So we're trying to find that path now, but we don't want to continue doing what past governments have done, artificially constrain rates down, watch the debt pile up for future generations, and not tackle the actual problem and get at the status quo and get this utility and energy costs in New Brunswick on a new path. So that's what our government is prepared to do. Now, NB Power goes through their regular business, so they have a process of applying for for rates to the EUB, a little bit like we talked about on gas. They have to show the cost to deliver energy, how much it's costing them, and thus how much they need to charge in order to recover those costs. The EUB considers all that information, decides whether they think that's accurate, rules on the rate application, sometimes pushing it down, sometimes accepting it as is. And so that will continue to go through the regular process that it goes through until such a time as we either receive the recommendations from the comprehensive review, make some changes to the act, to the regulatory process, or otherwise, and set forward on a different path. Okay, next question. So this one was really close to the NB Power question that had 84 votes for this question. When will you support adult day centers with funding that is comparable to the needs of care, programming, and food? This is a great question. I actually met someone not too long ago from Meaningful Connections in Oromocto who raised this exact issue with me, particularly around the cost of food and how it had gotten more and more expensive, but the supports from government hadn't changed, and so their ability to serve their clients was diminishing. So social development, for folks that aren't familiar, provides a per diem for every client that participates at an adult day center. The per diem was increased last year from $40 a day to $45 a day. And there isn't a financial eligibility assessment that's done for participation in adult day centers. They just have to be eligible for a long-term care program. So that's a change that we've made to make it an easier program to access. Social development does receive requests from adult day centers for additional support to meet the needs of their clients and their communities. They'll look at additional staffing. Cost of snacks and meals are typically the responsibility of the clients. So that's a policy that, because it's been raised with us and because those costs are being covered by a number of the centers that do that on behalf of their clients, it's something that we're going to have to look at. The policy had been that was paid for by clients, but recognizing, as I said, not only those costs going up, but people having a hard time making ends meet. And so looking at ways that we can maybe improve the supports beyond the increase to $45 a day and the change in the assessment process. Next question. Why is the province allowing NB Power to contract an American company to build a gas plant in Tantramar to the detriment of the land, the water, the air, and the residents? So this question received 67 votes. And this one I could probably talk about for a long time. I'm conscious that we're almost halfway in here. So this started off with NB Power. So NB Power was looking at their forecasts for energy demand, and when they did a re-examination of those forecasts, they saw that our ability to supply power against demand was going to be constrained as early as 2028. And they thought we have a need for more generation, and particularly generation to support the renewables project that NB Power had been working on. And this is something that government has supported and directed NB Power to do, was to go out and look for expressions of interest to develop more renewable energy in New Brunswick. They did that. They tendered 650 megawatts of renewable energy, received lots of wind projects, solar projects. I think 450 of those megawatts were contracted. They've put out a second call for another 400 megawatts of renewable energy to be added to the grid. And with that much renewable energy, we're now looking at our tools to balance those renewables. So as that wind power comes online and the solar power, we use our coal generating stations, so Coulson Cove and Beldoon. Those are our balancers right now because you can fire them on and fire them off pretty easily. We use Mactaquac as well. Mactaquac is really great in a pinch. If LaPro goes down, Mactaquac can open up and make sure that there's a stable supply of power. But we needed something to add to the system that could generate power and balance renewables before our generation capacity was extended past what we could deliver in 2028. So the technologies out there that I'm told were available was this gas peaker plant that acts as that balancing piece that you can fire on at the drop of a hat, that uses natural gas as its energy source, and was something that could be actually built, installed, created, and then turned on within this sort of limited 2-year window that we have to get a project done. So NB Power put out a tender and asked companies to apply and provide solutions. A number of companies did. The least expensive bid, that was also the only one to meet the timeline of 2028, was a company in the US. I believe they're called ProEnergy. And so ProEnergy was awarded the contract, and then they began the process of identifying sites. I think they were looking at sites in Skuduk initially, in Tantramar. I think there were other sites evaluated, and now they've gotten into the process of what they believe to be the best site in Tantramar, and going through now an environmental impact assessment process to determine whether that can work there based on our standards and expectations from an environmental protection perspective. I very much appreciate the challenges that folks have had with information about this project, with engaging as a community, with questions that people have wanted to ask, with opportunities to get that information from the proponent, with the validity of that information. There has been lots of challenges through these early stages of the project, and so a lot of work that needs to be done to make sure that all of the questions are being asked, all of the information is coming forward, is getting vetted and validated to determine whether this can work. We're asking questions as well about alternatives to make sure that we can deliver the power New Brunswickers need as affordably as possible, as sustainably as possible, and in the most environmentally friendly way possible. We can't run out of power. We can't charge people through the roof for power. We do not want to harm the environment with our generation of power. And so this is a project that's looking at making sure we don't run out of power in the most cost-effective way, and looking at the environmental impact of it right now. The environmental assessment hasn't been completed or approved. So there's still more work, a lot more work to be done on this one before it is at any sort of final or go-ahead stage. That's that one. I'm going to pause. Thank you, Belleville Orchards, or thank you, Natasha, I should say, our MLA from Diet Memram Cook, who brought in some sparkling apple juice from Belleville for our team last week. Okay, la prochaine question.
Next question. When are we going to have a reasonable increase for old age pensions to follow the cost of living that continues to increase with the increase of 0.07%? It's not going to be enough. So this question was the next most popular question, and it was in French. But the question of old age pensions, it is something that is a responsibility of the federal government. So the provincial rates do not set the rates for pensions. CPP, so I encourage you to speak with your federal MP if you believe that the cost of adjustments should increase for pensions. For us, we offer a provincial payment for seniors with low income. So you can present a request up until December 31st at each year. And if your request is approved, you can receive up to $616 to help you to face the increase of the cost of living. We're also looking for new ways to help our seniors and to give support. We're talking about property taxes and the ability to have a program in the billing as well. But for this question, a pension, it's a question that comes from under the federal purview.
Received, so this one had 46 votes for it, is why are seniors in New Brunswick having to pay for the shingles vaccine when the other Atlantic provinces are giving it for free? So this is a question that I've received quite a bit ever since our neighboring provinces, I think in Nova Scotia, I know Newfoundland had said they were going to do it. I think they're in the processes of working that out. I believe Nova Scotia just announced a number within this last year that they're going for it. and PEI as well. And so we are exploring it as well. We're looking at the options to publicly fund it, what it would cost. We're engaging with the folks nationally who maintain a national vaccine registry. It was the same process we actually just went through for the RSV vaccine, that our government decided to fund and make the RSV vaccine for seniors make the RSV vaccine free for seniors in this province. But we went through the process of making sure that it was approved and studied at the federal level, and it was, and that was the recommendation. So we want to look at that health evidence. We want to assess the programs, the different age cutoff levels that different provinces are using for this one, make sure that we know the costs and the delivery mechanisms. But I appreciate that this is something that people are paying hundreds of dollars for, that it is absolutely not pleasant to have shingles, and can, if you're vulnerable or older, find you in a hospital dealing with it. And so anytime we can prevent hospitalization with an upfront investment to make a vaccine more accessible, that's good policy. So this is one that we're looking at, and we'll do the proper due diligence, but understand that it's something that New Brunswickers are looking for, and we'll work to move on it as quickly as we can. Okay, la prochaine. This one's a big one. I'm just gonna check the time, 7:30, so good, because this one will probably take quite a bit of time. But
Celle-ci va prendre beaucoup de temps, mais finalement, une question sur la santé, 43 votes en anglais et 11 en français. La façon que la question a été formulée.
que ma famille et moi, une famille de 5 peut-être, nous sommes 100 médecins de famille.
We don't have a family doctor. We're in Zone 4, and we were never referred despite the arrival of a new doctor.
And to improve healthcare and reduce wait times, ER, tests, surgeries, referrals to specialists, and when can we expect to see improvements? So lots of pieces in there. I'm going to talk through a bit about the things that we've done in the last year to change the healthcare system, and how we believe that affects wait times and access to care, and the things that we're doing to help families who have been on the waiting list for a family doctor for 5 years in this case, or others, get that wait list eliminated and get people the primary care that they need. So right away we started implementation of our vision of what a collaborative care model of healthcare should be, and what the family health teams could be in New Brunswick. That starts with the simple model of bringing together doctors and nurse practitioners, nurses, pharmacists, physiotherapists, all sorts of different health practitioners together to provide the right service to New Brunswickers right there in their community when they need it. And figuring out, how do we support that kind of model of care? What kind of administrative supports do we need to provide? What kind of technology supports do we need to provide? How does the compensation system need to change? What are the policies? What is the legislation that needs to change to allow for this to work? Because you can imagine there's lots of bureaucracy and rules that say you can't do this, you can't pay for that, that kind of thing. So we've been working with the regional health authorities, with Horizon and Vitalité, on what our vision for this collaborative care model is. We had committed to putting that in place in at least 10 clinics this year in 2025. As of now, we've got 7 open, but I am guaranteeing that we are going to have at least 3 more announced, confirmed before the end of this year, and that those teams of people where we have added doctors or nurse practitioners, social workers, respiratory therapists, you name it, provided them with administrative support, provided them with the technology, in some cases the space to provide care, have started taking people off the waiting list for care. So the 7 clinics that we've done so far, those clinics have committed to taking 10,600 more people off the waiting list. So far since April, Horizon, is it Horizon that tells me? Make sure I get this data right. I think it tells me that we've gotten about 8,100 people have received care since April, although I think now I'm bouncing into a different box. And so there's more to be done there. Obviously, we've got 3 more clinics to open this year, and then next year there's going to be at least 10 more family health teams started in the province. On va aussi avoir.
We will also have, we will see the results of these investments in training.
From primary care, we have to make sure that we have the pipeline of nurses and nurse practitioners and family doctors and others in the system. Alors notre gouvernement.
So our government is investing in training in the training center at the University of Moncton. It was 32 places, but we added 8 more so that we have 40 in total in order to train doctors here in New Brunswick with our partnership with Dalhousie University and the University in St. John. There's another 40 places for family doctors, English-speaking family doctors in St. John. So we can train 80 doctors, family doctors here in New Brunswick. We also provided supports for residencies for those programs. We also started to see a number of nurses join the programs that we're offering, where we have retention bonuses for nurses in New Brunswick, because we noticed that there were a lot of nurses that were leaving the profession in New Brunswick following the study that was published a few weeks ago, that up to 2023, there were so many nurses that would quit, that would leave the profession here in New Brunswick. So the first thing that we did was a retention bonus for nurses to ensure that they remain in the system, that we could retain them, and that we could focus more on recruitment. We signed our collective agreement with the Union of Nurses, and with a competitive salaries compared to Nova Scotia and other provinces that will allow us also to retain nurses.
A collective agreement done that is competitive with our neighboring provinces makes it attractive to be in nursing here, with the investments in family doctor positions at the University of Moncton and Dal Med in St. John, with the transformation of the primary care model and the rollout of those 7 family health teams. We've been making some pretty big strides, and at the same time, lots of work being done on technology. I want to give you some specific numbers, and this is hot off the presses, new data. I don't think that we've pushed out yet. Since taking office, November of last year, we have hired 157 doctors. Now, I'm going to couch that with the fact that, as we all know, there are numerous retirements happening. And so we hired 157, 73 exited the system or retired. But that means 84 net new doctors have been added here in New Brunswick over the last 12 months. And we're excited about that. And actually, if I talk about just the last 6 months, so if we go back to April, which is where our fiscal year starts, we have added 34 family doctors specifically. So 34 new family doctors hired, 18 practices that closed or family doctors who left. So that means 16 net new primary care doctors. And then in terms of specialists, we hired 59 new specialists here in New Brunswick. We unfortunately lost 19 who exited either for retirements or other reasons, and that means 40 net new specialists in New Brunswick. So last year, if we look at the fiscal year that ended in March of 2025, the total was 64 doctors in New Brunswick. This year, in the first 6 months of the 2025-26 fiscal year, we have 56 new doctors hired. So we are ahead of the curve with 6 months to go. I think we're gonna blow last year's result out of the water, because the team has been working really hard on that recruitment and to make sure that we have attractive places for family doctors and specialist physicians to practice. I think about here in Fredericton, the hybrid OR that we've invested in at the DEC that's helping us to recruit and attract vascular surgeons is an example of that. And I also want to give you the nurses' numbers because these are important as well. The whole system works when we have all sorts of different health professionals, allied health professionals, nurses in the system, along with the doctors I've listed. So a whole bunch more numbers for you. On a embauché.
We hired 385 nurses last year. 153 left, either retired or for other reasons. That means 232 new net nurses. For registered nurses. That's much more than last year. 232 new compared to the 385 that we hired. And for nurses, practical nurses, there are 69 retired. And this is in Horizon and Vitalité. It doesn't include long-term care nurses. 205 minus 69 is 136 new practical nurses in New Brunswick, nurse practitioners. So we are increasing the labor force and ensuring that we can offer better care to New Brunswickers. We're investing in training. We have a new program for paramedics.
Cold going around. I hope everybody's getting their flu shot. So we put a paramedic bursary program in place to also help make sure that we had the health professionals that we need. And this year there are 151 students enrolled in, thank you very much, Michael. 151 students enrolled in the paramedic programs. That compares to 74 students in 2024. So almost a doubling, actually more than, am I doing the good math there? Yeah, more than doubling the students enrolled in the paramedic program, which is another area where we had shortages. So lots and lots of work being done to make sure that we're training the professionals that we need, that we're giving them an attractive environment to practice in, that we're retaining people in our system, that they're being paid competitively. We've worked out collective agreements not only with the nurses, with the nursing home union as well, with numerous different locals with CUPE, and we're going to continue to do that. Oh, one thing I missed actually that's also related to this is the labor mobility piece. So we implemented a program of credential recognition so that anybody who has a Canadian credential in healthcare can come and practice immediately when they land in New Brunswick. They just have to let the registrar know that they're here and provide that copy of their other province certification, and then they can get going so that we don't have to wait weeks and weeks, in some cases months, to go through that process before they can start caring for New Brunswickers. So that's something that has helped as well. I might as well take a minute just to remind everybody where those 7 family health teams are based. On a créé les équipes de soins familiaux.
We created these family centers in Campbellton. This is a new one. There were 2 family doctors that retired. We hired new family doctors, and we also added nurse practitioners. So there's one in Moncton with nurse practitioners, in Carlton North, in Florenceville.
The addition of more nurses. There's also up in Florenceville, we're working with the pharmacy there to expand what they're able to do for patients. So looking to get that nailed down shortly, as well as continuing to work with the team in Woodstock on that opportunity there. The Tantramar Clinic we opened and added capacity to. À la Mecque, les cliniques aussi.
The one in La Mecque and the one in the northern part of Fredericton. Those are family health teams that take new patients, that provide more care, and there are a number of others that will be added as well in the coming months. And the last thing that I'd like to mention, I know there's a lot of information and questions related to health. The last part of the question, it was about when can we expect to see improvements?
And look, that's a question that I am asking every day. right? We're out there doing this work, investing in training. We know there's a lag. You have to get somebody into the class, get them trained, have them learn, then they graduate, then you can employ them in the system. We set up these collaborative care clinics and they start to take people off the wait list, and then that snowballs. And so we are hoping that if we continue to invest in forming the healthcare professionals that we need, to make it a really attractive place to practice here, to continue to accelerate the rollout of the family health teams and those collaborative care clinics around the province, that we will start to see that tipping point where the list stops growing and actually starts shrinking. And I'm hoping that that's going to come as soon as possible. We committed to getting that, to getting the coverage in the province up to 85% before the end of our mandate. And I'd like to see us beat that. So we're checking these statistics and our performance every quarter. And constantly tweaking what we're doing to make sure we're doing the right things that make this the most desirable place to be a healthcare professional, so that New Brunswickers can get served in clinics close to home and don't have to be waiting for a dozen hours at their local, if they have a local emergency room. So I'm hoping that you will start to see and feel those improvements sometime around mid next year to the fall. Some people are starting to see it if they're the lucky ones that have come off the list and have gotten a new doctor. And maybe they're seeing it in some of the relief and support we've been providing to nurses, or maybe they're seeing it because they just had a new grad help them out on the ambulance. I'm hoping that we'll start to feel the benefit of the 12 months of hard work that Dr. Dornan, the team at the Department of Health, the team in the health authorities, our partners at Medivy, and everyone who's out there in the healthcare system right now who's working to speed up the changes, to change how we deliver care, so that New Brunswickers can get better, quicker access where they need it to be for as quickly as possible. So I wish I could tell you you're going to see improvements on December 18th. We have a schedule to make those improvements, a timing on the targets that we want to hit ourselves for people off the list, and for wait times reduced, and we're going to hold ourselves accountable to that and ask you to do the same. But I really hope you'll be feeling some of the benefits of this work and these investments into next year. Okay. Maybe that will help. Okay, next question. We had 42 votes for this one. What are you doing for the single New Brunswickers who are working and struggling with the economic instability to own a home, pay rent, and get ahead of bills? Every benefit seems to be for families. So I can appreciate that, actually, as you're hearing about different things that are being done and thinking, well, that doesn't apply to me, and that doesn't apply to me, and what am I eligible for? So a couple of the things that we did were broad-based, I'll say, and I think that single people as well as families could benefit from them. I mentioned the 10% that we took off electricity bills. That applies regardless of the status of the home. Or the apartment. We did implement a rent cap at 3% because we were seeing rents increase dramatically here in New Brunswick to the tune of 10, 11%. We had the highest increases in the country, and so we've capped those at 3%, and that benefits all renters. We did freeze the property tax assessments as we overhaul the property tax system, so that's something that it's for homeowners, I guess, whether they're single or family alike. And now, just today, that taking the cost of carbon adjuster off the price of gas, that reduction of 8.24 cents on the price of gas, that benefits anybody who goes and fills up at a gas station here effective December 1st. So we do try to balance what we're doing that is broad-based and that would benefit everyone versus some of the more targeted programs like the school breakfast program that's targeted at kids and making sure that they can get a good start to their school day, or something like the RSV vaccine that's targeted at seniors. So that's a few of the things that would apply to single New Brunswickers. The next question. I think I've got two more questions here, and then en français. So this one got...
C'est 40 votes. Avec le coût de la vie qui est assez élevé, il y en a qui luttent pour avoir un emploi dans leur domaine. Le gouvernement va-t-il faire quelque chose à propos des prêts étudiants pour offrir un soulagement ou de débarrasser de la portion provinciale? on entend que c'est, et ça a été, de l'argent d'être un étudiant maintenant avec les coûts, que ce soit des appartements, l'essence à l'épicerie, comme on a mentionné autrement, les coûts augmentent. Une chose, j'ai crédité le gouvernement précédent, ils ont enlevé l'intérêt sur les prêts étudiants. Et ça, c'est une politique que nous allons garder en place. Alors, les frais, avec les prêts étudiants, ne génèrent pas de l'intérêt. Tout ce que vous placez sur votre prêt étudiant va payer pour l'équilibre de prêt étudiant. Il y a quelque chose mis en place, tel le régime d'aide au remboursement et le système pour les emprunteurs avec des personnes ayant un handicap. Ceci, ça peut, si vous faites la demande de cela, ils peuvent réduire ou même poser vos paiements de prêts étudiants si vous avez besoin de cette aide. Et on encourage les gens de vous rejoindre. Votre compte des prêts étudiants nationaux, c'est là que le processus d'aide se trouve et vous pouvez faire la demande par votre compte si vous en avez un avec le programme national des prêts étudiants pour tirer avantage de ces points-là. Mais ici, au Nouveau-Brunswick, on ne demandera pas d'intérêt, on ne fera pas de l'argent sur vos prêts ici. Et j'apprécie la suggestion qu'un certain de soulagement qui peuvent être faits pour les étudiants qui luttent pour sortir de leur dette étudiante. Prochaine question, numéro 30.
7:50, so 10 minutes left. Nova Scotia, PEI, and Ontario have no provincial tax on children's clothing, footwear, diapers, car seats. Why can't New Brunswick do the same by simply reducing arts grants or similar luxuries in provincial spending? So this is an interesting one, and this got 39 votes. I don't know if I said that. I'm going to give you the simple answer, and then I'm going to give you a bit of a wonky answer for those of you who are interested in stuff like that. This question gets at something we've been talking about quite a bit tonight, and that is the cost of living and how expensive everything is, and the fact that a number of kids' expenses are tax-free. And so if other provinces and even here in New Brunswick have removed tax on some of those things, why not more to help with the cost of living? And we've been looking at a lot of ways to make life more affordable. So this is something that we have looked at to see how it could work, to see what items we could target. And one of the things we learned about this is, if some folks may remember, that we originally committed that we would take the provincial tax off of your power bill, the provincial portion of the HST. But that is governed by an agreement that we have with the federal government on tax sharing. So when we put in that harmonized agreement, we agreed that we would share tax, and we are allowed, I think it's a 5%. So we are allowed to exempt 5% of provincial purchases from provincial tax. There's some things that are already in that category, so that's used up some of our credits. If we had used our provincial sales tax and exempted it, that would have eaten up, because it was about $90 million worth of savings for New Brunswickers, that would have eaten up a lot of our 5% room and left us with a very small amount left to play with. And so instead we thought, we can put this on as a rebate on your bill, save us that room, and actually consider what other items we could potentially exempt from provincial tax to respond. So there is a little bit of an analysis happening right now to weigh up what targets who. I mean, if we look at the previous question, it was also asking about what benefits singles, what benefits families, what benefits kids. The description here names footwear, diapers, car seats, some expenses that are particularly child-related. So that's something that we're digging into to understand the costs, the benefits, and the best way to do that, and comparing the mix across provinces as well. So no final decisions yet, something that's definitely worth reviewing, because we think we could have some targeted tax relief there for New Brunswickers. OK, je pense que je peux faire deux autres.
I believe I have two other questions, maybe. The next is a question in French that received 14 votes on the French side. Why don't you have any regulation for people who are owners of apartment buildings to prevent increases of rental for residents when they decide to do so? So we've set a cap at 3%, February 1st, 2025, it's in place. It's going to stay there in 2026 as well. And it is something that apartment block owners must follow that cap. If they don't follow it, it is something that we ask you to let us know because it goes against the regulations and they can't do it. So if it's a reality for you, please let us know. And we have a review of the act on rental properties to offer greater stability to the renters and to modernize that act and to make something stronger, more clear for the owners and the renters as well. So it's been quite a while since it just needs to change. So if you have people who are increasing their rentals more than 3%, please let us know.
Tenancy, landlord, residential office. I don't have that acronym right. But there should be one in your community or a line that you can call, actually, and I apologize that I don't have it memorized off by heart. Mais il ne peut pas.
But they cannot raise your rentals more than 3%, so we can help you if that's the case.
See, there's lots more that I did not get to, as usual. Okay, 40 votes for with, oh, no, I've already answered that one. Okay, what are you doing to help the working class that are the working poor? There are no resources for people who are in the average income bracket and we're falling behind because of it. What will you do? So this question had 29 votes. It's actually similar to the previous one that was asking about singles. And I've heard this actually repeatedly from folks who feel like they don't fall into that lower bracket where there are more supports available because there's an income threshold and they're just above it, or that they're the working poor, so they have an income, and sometimes just the fact of having an income renders them ineligible for a number of the programs that are targeted to help folks on social assistance or to help people who are struggling and vulnerable. So feeling like you're just getting by and that's where all the supports end. It's something that I've heard expressed because more and more people are feeling the strain of the cost of living, and it's starting to affect more of our population. So I don't want to sound like a broken record. I'm going to list off some of the things we're doing that do affect everyone regardless of income level. So the 10% off your property tax bill, the freeze of your property tax assessments, the 10% off your electricity bill, the rent cap at 3%. The overhaul of the property tax system will benefit all property owners. The 8.24 cents off of the price of gas at the pumps. Those are things that are all targeted to help New Brunswickers, working poor, and others. Certainly the school breakfast program that helps families that are really struggling to put food on the table and to send their kids off with breakfasts or a lunch bag every day and know that they can send their kids to school and they'll be able to have a healthy breakfast at school to start their day. So that's something that we believe helps those folks that are having a hard time at home. And there's more that we can do. So there's commitments in our platform on this subject that are teed up for us to work on and roll out in the years ahead, because not a day goes by that we're not thinking about how can we make life more affordable. That's why we took the cost of carbon off the price of gas today. That's why we're looking at more measures, more property tax reforms, other ways that we can help you tomorrow, and we're going to keep doing that. Alors, je pense que ça nous rend.
So I believe
I hope I didn't skip over any questions in the order. I'll say again, we'd love your feedback. The way that we had done it this time, putting out the opportunity to submit questions for 2 weeks, gathering those 300 questions, then giving it a week for you to vote on those questions, and then tackling the ones that got the most votes. Let me know whether you like this better or differently than the previous version, or if you have suggestions on how we can do this differently. Moi, j'apprécie énormément.
I really appreciate the fact that you've submitted 300 questions. It helps me with our team, entire team, to see what your questions are. it's typically different from the questions from the media. And for us, we want to be available to the media, but we want to be available for you. And we want to know what are your needs for information, what are your priorities that you want us to work on. For ourselves, our focus was the healthcare system and to improve your access and to make your life more affordable. These are two major priorities that took a lot of our work during our first year as a government. But your questions that you're asking us, that you're sharing with us, they really help us to adjust our priorities, to change our way of thinking, to put in place good policies, good investments, good bills and laws that answer what you want.
One of these questions to everybody who voted, the 1,800 and I don't remember what the number was now, 1,943 votes that we received. It is extremely helpful for us to know what's on your mind and what questions you're asking, because they're sometimes different from the questions the media is asking. So we make ourselves available to media, we make ourselves available to you to hear your questions and to learn from what you want to know to make sure we can get you the information you're looking for and that we're doing the work that you want us to be doing on the things that matter most to you. For the first year of our mandate, it has been healthcare and affordability, making affordable housing a priority and making sure that you're getting better access to healthcare. And going forward, we will continue to focus on those things, but we'll adjust as we hear your questions, as we get your feedback. We want to make sure that we are working on the things that are most important to you. So thanks for tuning in tonight. Merci beaucoup pour vos questions.
Thank you very much for your question, for your suggestions, for your commitment, for the fact that you're so interested in New Brunswick, that you're here with us for an hour this evening to listen to these questions.
Thanks so much that you just spent an hour watching this live Q&A. I really appreciate it. I love this province too, and I hope you have a good night and a happy Halloween. Bonsoir.